News Channel 8 presents New Skills for Living with your host, Tom Lavin, a healthy plan for healthy living.
Hello and welcome to New Skills for Living, a show dedicated to healing and wholeness in our community. Today we're going to continue our series on addiction recovery, and specifically we're going to focus in on the role of medications that are helpful to people when they're detoxing from alcohol or from opiates, and also medications that do help during that detoxification process. Now, before I talk with our expert guest, Alexis Ryan, I do want to mention that if any of you are having any thoughts of stopping drinking or stopping your medications, please be sure and talk with your physician before you make that decision. Alexis is going to provide us with some really good information, but make sure you check with your doctor before you make any healthcare decisions, okay? So I'm very pleased to have Alexis Ryan with us. She's a pharmacist working in ambulatory care. Alexis, thank you so much for being with us.
Thank you for having me.
All right. So when someone has entered a treatment facility and they're detoxing off of alcohol, why is it important that they be monitored, Alexis?
You know, the reality is that detoxing off of alcohol is a life-threatening situation, or it can be. So the severity of a patient's symptoms, in addition to any pre-existing conditions they might have, need to be evaluated by a professional. You know, something like a pregnancy or pre-existing heart condition. The severity of those symptoms really do determine the course of therapy, whether the patient is going to be seen inpatient or outpatient, and what medications they might be given.
Oh, that's an excellent point. And I guess the next question it would lead us to is, what are some of the symptoms of withdrawal?
Well, there's a wide range of symptoms someone can experience, but you know, these range from headache, tremor, sweating, agitation, anxiety, nausea and vomiting, even hallucinations. Those tend to start anywhere from 6 to 48 hours after the last drink, and can last from anywhere from 24 to 48 hours. But what we're really trying to prevent is something more serious called delirium tremens, or DT. And that's just a much more severe form of detoxing. You can have much more severe seizures, hallucinations, and that delirium. So what we're trying to do is prevent that. And the way that those things are measured in a treatment facility is something called a CWA scale. For you and I, that's just basically 10 questions that are asked to a patient to determine what their symptoms are and what their risk for developing seizures are.
And so when someone is going through withdrawals, and this sounds very critical, it's very important that they have the right medications. Can you tell us a little bit about that, please?
That is correct. The correct medications are very important. And while someone's in a treatment facility, we do have a few very important goals. The first is to make sure that the patient is not we're relieving their discomfort. This is not a fun process for people to go through. We want to make it as easy for them as possible. We also want to prevent those DTs, or delirium tremens, that we had talked about. We also need to remedy any nutritional deficiencies the patient might have, and treat and evaluate any other coexisting conditions. So that CWA, that scale we talked about, is given every couple hours to the patient. Based on the number that they get on that scale, they're going to be given a benzodiazepine, which a lot of people know those as anxiety medications.
Yes.
Well, in this setting, they are actually used to help prevent seizures. And which one that you're given is really dependent on your prior history, the status of your liver, your age, other things like that. A lot of facilities tend to use something called diazepam. It's a long-acting benzodiazepine medication, which is good, not a lot of highs, not a lot of lows. Problem is that it actually is processed through the body in the liver. And a lot of patients who are alcoholics have problems with their liver. So in that case, we wouldn't use that. We'd use maybe something else called lorazepam. A little shorter acting, but it's processed through the kidneys, so it's safer for those patients. Also, we don't want to use those long-term. Those tend to be addictive on their own.
The ones that have like a longer half-life?
Yeah, so the benzodiazepines are addictive, so we try and minimize the use of those to just a couple days of using that medication. And because of that, some treatment facilities don't like to use those, but like to use other seizure medications instead to prevent seizures. So they may be using something like that. Or if the patient is experiencing that delirium tremens, the more serious kind of withdrawal symptoms, they can use something called Haldol. It's an antipsychotic medication, and it helps prevent some of the delirium and the mood issues that the patient might have during detox.
You had mentioned nutrition, Alexis. We have about a minute now. Can you tell us a little bit about the role of nutrition in the detoxification process?
Yeah, so, it's really important. People tend to forget, but, if you're drinking a lot, you may not be eating properly. Those low levels of vitamins and minerals are very important to correct. It's almost equally or more important than the seizure risk. So it's something that we do need to address in our facilities. We need to replace the essential vitamins and minerals that are lost. Even drinking alcohol does change the way we absorb those minerals. So it's one of the first things that we do look at in our treatment facilities.
Well, Alexis, that is some great information that you're providing for us here in this first segment. And right after this brief break, we're going to continue to take a look at this really important topic. Hello, up on your screen, you'll see the website, easeap.com, where you can follow this interview with Alexis Ryan, as well as all the other interviews in this New Skills for Living. It's available on streaming video on that website. And then I also wanted to remind you, those of you that have watched the show before, that on that website there are over 100 newsletters that deal with issues of depression, anxiety, stress, relationships, communication. You can copy those, download them, share them with friends if you want to. So as we continue on into this next segment about alcohol detox, I think we did hear Alexis talk about this is really a critical issue. It's critically, physically, for the patient to be detoxing from alcohol. Very important to have the right type of care. Alexis, you had started to talk with us about nutrition. Would you like to go ahead and revisit that and tell us a little bit more?
Yeah, so, some of the complications of patients who do not have the correct amounts of vitamins and minerals in their body, you can have brain neurological complications. Our body can lack the ability to make the proper amount of blood cells. We also can increase our seizure risk by not having these vitamins and minerals on board. So when a patient does come into a facility, they are immediately given a multivitamin, just a plain old multivitamin to replace what they're not getting in their diet. They also can be given something called thiamine, which is a B vitamin. This helps decrease any brain side effects, actually something very serious called Wernicke's syndrome. Yes. Without that B vitamin, you can develop psychosis, permanent psychosis. So this is just a simple add-on to help prevent that. Patients are given folic acid as well. This is one that helps prevent anemia, which is the making of new blood cells. So we're able to do that. And then they're also given magnesium. Studies have shown that may decrease our suicide, our seizure activity.
Yes,
so the patients aren't such at high risk.
Yes,
for that.
That's some excellent information. And when we look at recovery, Alexis, we're really looking at a whole continuum of care. And you were talking with us about medications that can be used in detox, but what about medications that might be available in the recovery process post-detox?
Yeah, so it's important to note that when they're in the facility, patients are generally given intense treatment, intense therapy sessions, and if they're still experiencing cravings or may have had a slip, there are medications that can help with that. So it's best used in patients that are highly motivated and under the care of a physician who's specializes in addiction recovery. So one of those that we can use is something called Camprel. This actually tends to decrease some of the anxiety and the restlessness associated with patients who are, feeling that desire to drink.
Yes.
This actually can help decrease the desire to drink.
Yes.
So that's a good one. Naltrexone can be used, and that will decrease the pleasurable effects of alcohol. So you don't experience that euphoria you get if you do take a drink.
So that if someone does drink, they won't experience the euphoria, so there's a disincentive, huh?
Exactly. And that's the good thing about that one. It can be given daily, but it also can be given as a once a month injection, which is good for patients who may experience slips or those cravings a little bit more often.
Yes.
One of the most common is disulfiram or Antabuse. Patients may have heard of that. And then actually that medication, if you drink alcohol, you have a physical reaction. Your body actually physically becomes violently ill taking that. So it's a good one. It's a little bit difficult, though, because you have to self-administer it, and some people say, I don't want to do that.
Yes.
So it can be used actually in a niche situation in patients who are in active recovery but know they're facing a situation that might be difficult. They may be tempted to drink. They could take this pill before then, and that might help decrease their wanting to drink
Yes,
at that point.
uh-huh.
Something else that can be used is something called topiramate. Now, those other medications have to be used while the patient is not drinking. This one actually can be used while the patient is still drinking. It decreases the reward area, the part of our brain that says, you know, do this again, do this again. So
Yes.
that's something that might be helpful to people. It's so important, too, that patients are monitored very closely in this situation by a doctor. Relapse is highest in the first 6 to 12 months, so they need to be followed and see if maybe we need to change to a different medication if one's not working for them.
Yeah, that is some great information, Alexis, and we want to get into talking about opiates. However, we want to go ahead and take the break because there's really not enough time to get into opiates right now. So we'll go ahead and take a break, and we'll return to recovery, detoxification and recovery from opiates right after this break. Well, and welcome back to New Skills for Living. We're now going to be talking about detoxification from opioids. And so, Alexis, would you please tell us about that process?
Well, you know, the difference between opioid detox and alcohol, one of the main differences is that it's not life-threatening. It's very, very unpleasant, but it's not life-threatening.
Yeah. So, you know, people talk about jonesing and being in a room with mattresses and sweating, but it's not life. Whereas, and people would think that maybe that's actually more life-threatening than alcohol, but alcohol is a much more critical detox process, huh?
Right, exactly.
Yeah.
And you know, it's not pleasant. We talk about, you know, patients who are detoxing from heroin or prescription medications, oxycodone, Percocet, Vicodin, and that's actually more common now. You know, it seems a lot more common prescription drug abuse. So when patients enter a facility, they're really fearful of that detox process because it's not fun. And so what we try and do is make that much more comfortable for them.
Yes.
We try and relieve the symptoms that they're having, especially because that fear and that anxiety can drive a patient back out. And that is a very scary situation because within 3 days of detoxing off of an opioid, you've lost your tolerance. So these patients may go out and think they can use the same amount they were using before, and they will easily overdose and may cause death.
Yeah.
So it's a very serious situation. We try and relieve, you know, a lot of their anxiety about the process.
Yeah, and so when you say drive someone out, actually, it's so uncomfortable, they say, oh, I'd rather go out and get high and try it again rather than go through this, huh?
Oh, right. Those symptoms can be very severe. You know, starting about 8 to 12 hours after their last dose of an opioid, they start this acute withdrawal phase, and that can last, you know, roughly 5 to 7 days. Symptoms, you know, may include, you know, bone pain, cramping, nausea, diarrhea. They can even have some reflex twitching that may occur. And it's just very uncomfortable. The body was so used to having a drug on board, and then all of a sudden that drug's not there anymore, so it tries to go back to normal much too quickly. And so they experience these symptoms. You know, and after that, you know, acute withdrawal phase, they can have a protracted withdrawal phase that can last weeks to months because that drug being on board and that addiction has changed the way their body chemistry is working. So, you know, it's important to monitor that patient for blood pressure changes, changes, you know, with hot and cold temperature, breathing differences throughout the, you know, months and months after they've detoxed. Keep an eye on them to make sure that, you know, their symptoms, they're not having symptoms that may cause them to go back to the drug.
Yeah, so if it's not monitored properly, the relapse potential is very high, huh?
That's definitely correct.
And so, can you tell us a little bit more about that, Alexis? So even though alcohol is life-threatening, but detox from opioids is not, it's really important, though, that a medication regime be established. And can you tell us more about that?
Yeah, so like with alcohol withdrawal, they had the CWES scale that we talked about. For opioid withdrawal, we have something called a COWS scale, and that generally just measures the patient's symptoms. The patients answer these questions and find out what are they experiencing right now. We use the score on that to determine what medications may be given. So if they're having a lot of diarrhea, we may give some Imodium or dicyclomine for cramping, Zofran for nausea and vomiting. They can be given non-opioid pain relievers such as Tylenol or naproxen if they're having a lot of bone pain. And they can also be given, you know, a non-addictive medication such as hydroxyzine to calm and relax the patient, so they're not having such anxiety with the process.
You know, just hearing you talk about this, it really strikes me about how important it is to have an interdisciplinary treatment team where there's a physician, an addictionologist, a nurse, a pharmacist, everybody chipping in to help out.
Everybody has something to bring to the table.
Yeah,
So.
yeah. So you were talking earlier about blood pressure and how important it is to monitor that. Can you tell us about that?
Yeah, so one of the main medications that's used, with this cow scale is a blood pressure medication called clonidine. It may not seem counterintuitive to patients that you're going to use a blood pressure medication for a detox, but this is actually used, it actually dampens those withdrawal symptoms the patient is experiencing. We use that cow scale again, and that blood pressure medication decreases any heart symptoms the patient may be having, temperature changes, things like that. And it's scheduled generally every a couple times a day, as long as the patient tolerates it. We don't want the blood pressure to go too low, so if it is, they might hold back on it a little bit. But it is definitely used in the detox process.
Now, of course, another medication that's used in detoxification or maintenance of recovery is methadone. Can you tell us about that?
Yeah, methadone is used quite a lot in the detox process or after the patient has already detoxed from medication. And it's got a lot of pluses and minuses. People are kind of on the fence, whether they like it or they don't like it. What we're really doing with methadone is replacing one opioid, a bad opioid, with something that they say is better or good opioid. This is just a much longer acting medication, so the patient doesn't have as many cravings or withdrawal symptoms. Ideally, it would be used for a week in detox to kind of get the patient off of the opioid, but a lot of times we have to use a higher dose, a longer dose, because patients tend to have a lot of cravings, and this is there to help decrease cravings. It's dosed so that the patient doesn't have cravings. So we're kind of using that medication for that. The issue with it for some people is you can't get it at a pharmacy. You have to go to a methadone clinic to obtain the medication. For some people that's a stigma, but for other things, it's good. They get to interact with a medical provider every time they go to kind of check up on their recovery process.
Yeah, well, that is some excellent information, and right after this brief break, we're going to continue to talk about this really important topic. Welcome back to New Skills for Living. We're going to continue talking about the role of methadone in opioid detoxification. So please, Alexis, tell us more about that.
So we had left off saying that methadone does have its positives in terms of patient going to a methadone clinic, being seen by a medical professional every time they go in to answer any questions they may have, assist in their recovery process. Yes. It also may have some negatives. What we're really doing is replacing one opioid with another opioid, and it is still addictive. The medication actually, because it's such a long-acting medication, can build up in the body over time, and that can lead to overdose, which is a scary process. Also, when patients are saying, I think I want to come off this medication, it does take a very long time to detox off this. So it is a long process, but a lot of people still say, it's safer than the alternative. It's safer than the drug of choice for the patient. Less harmful effects of the patient, less harmful effects on society in terms of, drug abuse problems. Yeah.
Plus, someone is being monitored by their physician, and they're in group therapy and
exactly, which is very important to the recovery process.
So, thanks for that information about methadone. Now, are there some other alternatives you could tell us about?
Something that's gaining a lot of popularity is the use of Suboxone. It's actually a mix of 2 different medications that does help decrease cravings. It can be used in the treatment facility right when the patient comes in, but it can't be used in the form with 2 different medications. If it's used that way, one of those medications actually will send the patient into immediate detox, and they'll have very strong symptoms, very uncomfortable for the patient. So if while they're in the treatment facility they're experiencing cravings, they may be given something called Subutex. And it's just one of those components, and it helps, like I said, decrease cravings. And then once those withdrawal symptoms start to kick in, or the opioid's completely out of the body, they can use Suboxone. Ideally, like we said with methadone, it would be used for a week, 5 days or so. But a lot of times patients do have those craving symptoms. It does need to be used a lot longer than that, and it can be. Some of the nice things with Suboxone is that it can be obtained from a regular pharmacy. You don't need to go to a methadone clinic. Also, physicians that prescribe Suboxone can only have 30 patients on the drug at one time. So they have a lot of individualized care, and it's really important to have that when you're on this kind of drug.
Yes, it sure is. So after someone is through with the detoxification process, are there medications that are used in ongoing recovery?
Yeah, well, one of the most important things to note about this process is that drug-free treatment alone is rarely effective. You know, we need to have a combination. You know, intense therapy sessions are very important. It really gets the patient on board that they're engaged in their own recovery process. Now, if they're going through these treatment programs and they're really still having a lot of cravings, the medications that we previously talked about can be very helpful. It's also really important to note that the addiction has changed the way our body's working. It changes the way our mind works. So we need time to kind of get through that to have the body and the brain chemistry kind of come back to normal. So, you know, a patient should be evaluated by a therapist or a doctor who specializes in addiction medicine. Once the patient has kind of detoxed everything, they can reevaluate any underlying depression or mood disorders that may have led to that addictive behavior in the first place. And they can address those, you know, with antidepressants. They can be addressed with any antipsychotics. It can help balance the patient out and aid in their recovery process. It's also important that these patients are really evaluated over time. You know, it's important to stay involved in the recovery process. Patients should be involved in a support group, whether that's, you know, a 12-step program, family counseling, individual therapy or counseling. It is really vital to maintain their active recovery, to be part of one of those groups. Medications can assist in that, but really the entire package, that treatment process is really very important for the patient.
Oh yes, it sure is, Alexis. Now, we have about 2 minutes left in this segment, okay? And so one of the things I'd like to ask you, we're kind of focusing in on the patient.
Yeah.
But of course, the family is an important part of the treatment component too, the significant other, the wife, the children, the parents. And I know this is a little outside of the narrow scope of practice of a pharmacist, but you also treat the whole person. And can you share with us a little bit, because there might be family members watching, can you talk with us a little bit about the importance of family members being involved in recovery too?
You know, I think the most important thing that family members are aware is they shouldn't be afraid to ask for help. You know, even if the person who's in active addiction is pushing them away or resisting help, there's help out for them, and they can also talk to their physician about the patient and, you know, find out, you know, not necessarily they're not going to be giving these medications, but what signs to look out for that are dangerous for the patient. You know, what could be life-threatening. So when they need to really seek help, and then also, you know, there are, you know, Al-Anon groups or other therapy groups that they can really talk to somebody about the issues that they may be having with the patient who's in active addiction. They may not be able to change that, but they can help change themselves. That's
very good. And then just in like 15 seconds, if someone has been watching and they have a problem with alcohol or drugs, what would you say to them?
I would say that, you know, the medical community is here for you. It's a very difficult situation to be in. It's a very, you know, it can be very difficult. It can be very scary for the patient, but we're here to help. We're here to make this an easy process, as easy as it can be for you.
Yes, that's excellent. Well, thanks so much. And you'll see up on your screen where you can watch Alexis's show in streaming video at easeap.com. Next month, we're going to be talking with Charlie Ryan, another pharmacist, about addiction recovery. Thank you so much for joining us. And Alexis, thank you so much.
Thank you
really
for having me.
Appreciate it.